So Sturge-Weber syndrome is a congenital disorder where there's an abnormal formation of blood vessels, either over the skin, the eyes, or the brain, or all three. So seizures can vary depending on the part of the brain that is affected, but most often seizures tend to be what we call focal motor seizures, or movements affecting one side of the body. Seizures are caused by a change in electricity in the brain, and depending on the duration of the seizures and how often they happen, they can affect the health of the brain and cause damage to the brain, particularly in patients with Sturge-Weber syndrome. For this reason, treating seizures is extremely important in order to prevent further injury to the brain. When you have focal seizures, you want to shorten the duration of the seizure. And when you have clusters of seizures, which means several seizures back to back, in general, we consider this as 2 seizures in 1 hour or more frequent than this. We want to stop that cluster of seizure from becoming a longer seizure. So a cluster seizure is multiple seizures occurring back to back. And the goal is to try to stop this from becoming a larger seizure or more repetitive seizures. And there are several rescue options. We can use medications that abort the seizure, such as rectal diastat or intranasal medications. There are novel medications over the past 2 years, such as Nasolam or intranasal midazolam, or Valtoco, intranasal diazepam, which are used when patients have a seizure more than 3 to 5 minutes. And the spray can allow you to stop the seizure rather quickly and a little bit more conveniently and socially acceptably over a rectal medicine. So unfortunately, research is still pending on whether or not we can use nasal medications for all ages, but we have found that for certain ages, depending on the medication, we can have the same ability to stop seizures as we have had with rectal diastat. In fact, all seizures should be considered urgent, and stopping seizures improves your outcome overall and reduces the impact that the seizures can have on the health of your brain. But we try to stop seizures that are both prolonged or seizures that are happening frequently. And so we treat them a little differently, but both are important to stop.